Hey everyone, Derek Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. All right, my friends, this is a fun one. Today on the podcast, I have Dr. Elliot Justin, and we get into all things male sexual health. So I'll kind of bring that up in the forefront. A lot of what we're discussing is the issues and problems around male sexual health. And one of the things that Dr. Justin realized very early on is that we have a very poor way of measuring this, and it's very subjective. And as a doctor, he was like, look, this isn't how we run things. We need to actually figure out a way to measure this stuff so that we can see if we are improving or changing things like nighttime erections, intensity of erections during sex, all of these different things that play a vital role in the importance of sexual health and overall health if we look at the downstream implications. So on this episode, you're going to learn the role of muscle in sexual health, the importance of nighttime erections. We talk about a new device that Dr. Justin has developed and how we can actually use that to start to learn how do medications, how do supplements, how do lifestyle changes actually affect our sexual health, and the importance of venous leakage, what we can do about these things, a lot of the treatments that Dr. Justin has been able to test using these devices. We do dive into a bit of women's sexual health towards the end, so stick with us, women. We do get in it and show y'all some love, pun intended, and how this has been received by the medical community and all things kind of in between. This was a really fun episode. Dr. Justin has a ton of passion for this, and we get into some different subjects than we've talked about on the podcast before. So I really enjoyed the research implications of this. So I think even if for some reason you're not interested in male sexual health, I think that does affect everyone, but that there are some very fun conversations that we can tweeze out about how do we measure things in our lives. So I hope you enjoy it. I'd love to get some feedback on it and let me know what you think. So enjoy this episode with Dr. Elliot Justin. All right, Dr. Elliot Justin, welcome to the Pain and Performance Podcast.
Great to be here. Thanks for the opportunity.
I think this will be a slightly different performance episode than what we are used to, but nonetheless an incredibly important topic whenever it comes to health, even longevity, all things that you can measure from health. If we improve sexual health, everything is better from what I can see.
That's right. I mean, our sexual health is a reflection of our cardiovascular health and our cardiometabolic, our diabetic, potential diabetic health as well too. And we live in this age of healthcare wearables, Derek. I know so many guys that own Whoop and Aura and all these and Alpha, the Apple Watch, et cetera. But there's this big gap, and that's sex. And what do you and I and all men care more about? How many steps we took yesterday, or the status of our erections?
Yeah, what's more important in terms of a well-rounded kind of health objective than that? And it's interesting you brought up wearables. So I gave a talk in London this past summer on integrating technology into treatment in healthcare and the resistance of that. And while a lot of mainstream medicine is very apt to add technology into the diagnosis kind of process, there's still a lot of resistance from the medical society as a whole to use technology for treating things. We still kind of have this old pool of like, no, we want to do that. Don't let anything else be in control of that. And it's very interesting to me how much we'll resist that, yet we'll tout the state-of-the-art new MRIs and new scans and different tests. But when it comes to fixing those things, we don't want to kind of relinquish our control.
Isn't it really about money in the end, fortunately?
Probably.
Doctors really should. Years ago, I started a company called Swift MD. We were second oldest telemedicine the United States after the teledoc. And my vision then was, probably like yours too, was to empower people with the knowledge that physicians would apply, utilizing computers, diagnostic algorithms, and remote patient monitoring tools, like you mentioned. Use those things to empower people with knowledge that physicians would apply. They weren't motivated by secondary gain. And it's the insurance company and the CPT codes that unfortunately drive too much of physician behavior. So what we're doing is threatening as well too, and not just to the conventional doctors, but because when people don't trust the conventional doctors, and there are lots of reasons not to trust them today, they kind of turn to the naturopaths and the homeopaths and the integrated medicine community. But there's the same issue of money motivation on that side as well too. So for example, with our device, just jump ahead a little bit, men can test with personal data the impact not just of diseases upon their sexual health, but of medications. Doctors never warn people about the sexual side effects of medications, and the SSRIs, the blood pressure medications are calculus. But even bigger than that, the supplement industry. There's this huge supplement industry trafficking on men's concerns about their virility, about their desire to keep it up, to perform better, not just for men with ED, but for all men. And almost none of that stuff works. And we make the objective. Hey, you think the DH? We have a challenge that says, hey, you think that something's working for you? We'll test it.
Yeah.
So DHAA, L-arginine, morning goatweed, all these things, they ain't working. By the way, testosterone doesn't work for a lot of guys too. You can use our device to test for that as well.
So let's dive into kind of everything around this, because when we look at let's go into like how changes in health can negatively affect all things sexual health. But I think let's start with kind of erection, like the process of creating that and what all needs to happen so that someone can create and maintain an erection.
Well, you have to have blood flow. So right now, diabetes, hypertension, atherosclerosis, these are real pandemics in our society, affecting certainly more than half of the adult population over the age 50, and often people have more than one of those problems. Then you have to have blood flow, and of course we also give people medication to interfere with their blood flow as well too, because we want to lower blood pressure, but we don't think about the impact upon blood pressure in the penis. Then you have to have intact nerves, because you're going to be responding to stimulation. The people who really suffer from that issue are the diabetics, who not only have issues with low blood flow, but they also have damage to their nerves. And then they have to have smooth muscle function. And that's really dependent upon blood flow and upon the nerves, making the smooth muscles both open up and allow blood into the penis for an erection, and on the arterial side, blood flow in, and then on the venous return, constricting stopping the blood flow from leaving the penis. And again, there are diseases that we just mentioned before, and medications that impact that as well. It helps to have an imagination and good partner too.
Certainly. That's a different way of tapping into those nerves, right? I forget who it was. I want to say I may be giving him credit and he wasn't the one, but I think Tim Ferriss said like using your sexual health as a like lead domino for every other part of health makes it a very valuable thing to track. And yet he said that and everybody's like, absolutely, that makes sense. Like, you have to improve your cardiac health. You have to improve your blood flow. You have to improve your nervous system. You have to improve your muscle function, and specifically core muscle function very well. So it's like all these downstream effects if you're just trying to hit that lead domino. And yet one thing that I did not think of whenever this started to become a fairly kind of prominent thought is, how are we measuring those improvements? And that's something that I want to dive into with you, of course.
Sure. Well, let's just go back to muscle before, because there are two types of muscle. Most people have to go back to sophomore or junior high school physiology, and they probably forgot. But there's smooth muscle and there's skeletal muscle. Skeletal muscle is the muscle we can control, and smooth muscles, like the ones in our gut that help us digest food, those are the ones that we can't control. And sex involves both, but it's predominantly actually a smooth muscle issue. So you can't go to the gym and make your dick harder. You can improve. You can work on your rectal muscle tone, and that's important. You can work your core tone, but the core muscle, the most important muscles for sex, are the smooth muscles. How can you exercise them? Well, it's use it or lose it, guys. You need to be having sex, having an orgasm a couple times a week in order to exercise them. And we doctors, we make recommendations about diet, exercise, medication compliance, sleep. We need to start making recommendations about sex, and overall, we're too prudish to do so. And I think we're the first company, FirmTech, where I got my urology advisory board to agree. Yes, in order for men to be healthy, they should be having at least 2 orgasms a week in order to keep that smooth muscle tone.
2, you said?
2, yeah. More, of course, things better. But we measured the number of nocturnal erections, and that's kind of gotten a bit of play recently.
Yeah.
So that's how this company started. I'm not a urologist. My background, emergency medicine physician, and I will say that there's, short of a heart attack or a stroke, there's no emergency like a limp dick that upsets a guy. So but I got involved in medical technology back in 2015, and about 3 years ago, a urologist came and said, "You want to come up with a way of counting the number of nocturnal erections that men have, not in a sleep lab or with clunky machinery, but something that be done in privacy at home under real life circumstances." And my thought initially was, WTF? I mean, why do we care about nocturnal erections? I was unaware, as are most doctors, that the number of nocturnal erections that a man has is a leading indicator of man's cardiovascular, cardiometabolic health. And what do you mean by leading indicator? It means it's predictive. So blood pressure is associated with stroke and heart attacks, but declining nocturnal erections is predictive. So that took me back. And this guy, when he explained that to me, I thought, wait a sec, that's a sixth vital sign, and a more motivating vital sign than pretty much all the rest of the other ones for men in terms of their overall health. But my thought then was, not only can let's try not just count the number of nocturnal erections, let's also come up with a way of having a wearable that men can put on during sex that is going to measure the duration and firmness of their erections, so that, because that's more valuable information to men. I mean, what do men care more about? What happened last night while they were asleep, or what's happening when they're trying to perform? So that's the origin of FirmTech. Interesting.
So I want to kind of dig into the downstream effects of like the nighttime erection and like why that's so important. But whenever you started to go into that, what was your first like thought about how are we going to measure, one, the quality, but it sounds like the quantity. How do I get both of those data points from a wearable that somebody can do at home?
Yeah. Well, I was kind of fortunate in that my knowledge is limited. So I knew about pressure sensors and strain gauges, and by the way, also pulse oximetry. We will be adding pulse oximetry 9 months from now. We're testing that right now. But beyond my sensor knowledge, didn't go beyond it. There were about 10, 15 options. But the ones that I knew about just happened to be the ones that were going to be most effective. So it was fortuitous. Because ordinarily what an engineer would do is say, well, we got to test all these things. So basically, as the penis expands, it presses against the this elastomer ring. That pulls on. Yeah, I don't know. Is this being filmed?
Mm-hmm. Yep.
Oh, good. Okay. I'll show you the ring. My assistant here. So there's the ring. The testicles on one end, the balls are the penis on the other. As the penis expands in size, and by the way, this is one size fits all. If you're bigger than that, you're either very popular or you got a problem. So there's a strain gauge inside here that gets pulled on. That is a one sensor, and the other sensor is here. The elastomer, as the penis expands, pushes on that sensor, and that's how we get the data.
Gotcha. Yeah, we look at some of that stuff, in terms of treating people, and we've had a lot of anecdotal stuff. And whenever I started kind of digging into y'all's information, I'm like, hey, how valuable. We get so many patients who come in with like back pain and pelvic pain. And as they start getting treated with a number of different technologies, some of that being kind of hands-on, some of that being deep kind of perineural needling type stuff. We do some laser therapy that can penetrate quite deeply into the pelvis and into, the whole kind of shaft of the penis and through that whole area. And we get a lot of people who come back and say, like, this is incredible. Like, I feel a big difference. But to be able to measure that is a whole different world. Like the amount of information we can start saying, this works, this doesn't work. And for y'all to be the aggregate of that information is incredibly powerful.
Yeah, we'd love to work with you on some research because we want you, both you and I, what we want to do is help people fundamentally.
Right.
And we want to be objective. If we're going to, I'll be blunt. If I'm going to profit from someone, I want to be giving them something useful and not something that maybe makes them feel good because of a placebo effect. The placebo effect is powerful. I recognize that, but I want to make it objective. And in your world, you have the opportunity now with this device to establish a baseline. Someone comes to you and says, "I've got this range of problems, and one of those problems is erectile dysfunction." Well, you can actually measure that the erectile dysfunction objectively before and after therapy. And we have men who have. One of the most pleasing things to me, I'm certain you get these as well too. I say once or twice a week. I usually hear from most guys who are post prostate surgery, and they contact me and they say, I gave up because guys after prostate surgery, the range of impotence is 40 to 80%, and it's high, and if it is going to come back, it's going to take a long time to come back most of the time. And the guys give up on the therapy because it ain't happening. They get tired of pumping, they get tired of the pills, they get tired of the shots. Their wives are depressed, they're depressed. And if they see though that their number of nocturnal erections is increasing, that inspires people to continue with the therapy. We do erections on a 1 to 10 scale, and we had a guy 2 years out who told me that what could I do for him? He wanted to give up. And I told him, what we can confirm is that it's probably too late. If that's a value to you, then you should get the ring. Well, he got the ring. He used it for 2 weeks. His erections vary between 2 and 4. You need 6.5 plus to penetrate, or to even masturbate, really. And then one night he had a 10. And he like, where'd this come from? He actually woke up, put his hands between his legs, had a 10, and then he got more enthusiastic about his therapy. He started pumping regularly. 2 weeks later, just 2 weeks after he hit the 10, he and his wife had sex for the first time without extreme measures. Extreme measures being pumping, pop a ring on right away, ejection of trimix, and a really weak erection, and no orgasm. And now he and his wife had sex the first time. That's kind of cool.
Yeah, life changing and health changing. Like not being exaggerating. That actually will, change many levels of health, but certainly just from like a life standpoint, it's incredible to see that change. What was, like, let's stay on that story for a minute. What was the big shift? Was it that he was following through more, or was there a therapeutic effect? Like what culminated at that point?
That's a good question. He basically had given up pumping. He got a device. He started pumping again. Started taking he was taking high dose Cialis, and then once he hit the 10, then he started pumping 5 times a week as opposed to 2 times a week, longer periods of time. His doctor had given him a kind of like an exercise regimen, for pumping. He was kind of like a lot of patients. Hey, even me. It was, we can be really sloppy about following a doctor's advice. So that's for him, it was motivational.
Yeah.
And then our ring is also designed to enhance the man's pleasure as well too.
So let's go back to the nighttime erection thing. So at night, we go through a series of kind of cycles, right? Can you talk us through like one, why a nighttime erection is so important. Like, what does that signify? And also, like, why are we getting nighttime erections? What's happening throughout the night?
Well, I'll start with the why question. We don't
Yeah.
know. It's just speculation. So the speculation as to why ranges from the most common answer is that it's our body's way of drawing blood to a body part that doesn't generally get enough blood. So it's kind of, let's check it out. Let's make it work a little bit. I don't really know if that's true. We do know that during every episode, sleep scientists say that for healthy men, every episode of REM sleep, deep, the sleep, the quality sleep, so to speak, is accompanied by an erection. It's a marker actually of an erection. That's kind of interesting because it's possible that our device will be a more accurate marker than a peripheral wearable one on a finger or a wrist, which is using a accelerometer and pulse, whereas we're actually measuring the erection. But Derek, we don't really. I've not really heard a satisfactory explanation as to why we have nocturnal erections, other than that they're essential. If we don't have them, we don't have nocturnal erections, we will lose our sexual function. So there are men who are celibate, men who don't masturbate, their nocturnal erections will go down. And then if they try after a few years to recover, they can't. It's hard or struggle because the penis will atrophy without nocturnal erection. So they're essential to the health of the penis, but it has to be obviously it's not a conscious function. We don't will ourselves to have nighttime erections, and things that are not conscious, they're kind of mysteries. So just the way. So we don't know, but they're important.
It's interesting how much has been around some of this stuff. I heard we had Dr. Judson Brandeis on the episode, and we talked a little bit about some of this. And he said that one of the things they see is that it continues to kind of stretch out the penis, which allows for that kind of area for blood flow. And if we start to miss that, that's the first sign. Like if you start to wake up and y'all can actually measure it. I think everybody else is just guessing. It's like if you start to notice you're not having morning wood, like pay attention. It's a sign that you need to start to ramp this up. But if every male over 20 started to use a wearable, you would know right away, hey, I hit 30 and I'm 10% less. What am I not doing? Am I not working out? Am I not eating well? Am I not doing enough blood flow exercises? Have I changed something? Have I added a medication?
Yeah, I'm confident that what we're doing is it will become the standard of care for all men. I mean, a guy is 25 and can't get up. He wants to try some pills. He should also try a ring, by the way.
Yeah.
But I'm not kind of okay with that unless he's diabetic or really overweight or hypertensive. But as you and I both know, men when they go above 40, 45 years of age, they're entering the death zone. They're entering the atherosclerosis zone. And if I don't know how old are you, Derek?
38.
38. Let's imagine it's 6, 7 years from now. If you went to a cardiologist intern and said, "Hey, I'm 45 years old. I kind of like my health right now, but I want to establish some baseline so I can know how things are going to be over the next few years," and that doctor just put a stethoscope on your chest and thumped on your back and said, "Hey, Derek, you're okay. You're good to go." You would think, "What the fuck is this 1880?" So you would expect that there would be an electrocardiogram, maybe a stress test, a blood profile, including lipoproteins, and a whole series of other things. But the guy now in the future, they're going to want to know what your erectile fitness score is, because that's also an important vital sign, not just for your sexual health. And God knows we all care so much about that, but for your cardiovascular and cardiometabolic health.
Yeah, yeah. Let's go into this a little bit. So, is there just to kind of make sure that everybody understands? So, we've seen the ring. You put that on. It measures the intensity and the number of times that we have a nighttime erection, and then during sex, it measures the intensity and the longevity of that erection.
It measures the firmness of the erection and it measures the duration of the erection.
So and then so like if somebody has that and then we come on after, are they able to kind of fill out, here's how I felt about the erection? Like can they add a subjective component to that?
Yeah, there's in the app. I'm turning on my phone right now so I can show it to you. In the app, there's an opportunity to score the subjective components. In the app, you can say, I smoked pot, I drank alcohol, I was alone or I was with a partner. How many times did I have an orgasm? How good was it? There's a 5-star system for scoring. You can also, there's a comment section as well.
So like after, we get objective data and subjective data that said everything that led to that. Now, is there a therapeutic component of wearing the ring?
Yeah.
Tell us about that.
Yeah. The ring goes on differently. So most cock rings, they're hard silicone rings. They get slid down the penis. They choke off. They're basically a noose on the penis. Why are we treating the penis like we're a hangman? I don't know. I thought lynching went out a long time ago, and now we're still lynching men's penises. So the ring is, our ring is made out of soft silicone, so it doesn't block the arterial flow in. It only constrains the venous return. Our ring has a safety feature. It's easy on, easy off, opens and closes with a hook. What you do with the ring is you drop your, I can't start that. Anyway, I'll put on the ring and I'll show you what it looks like. You drop your balls into it. It doesn't get slid down. So it's really easy on, easy off, designed for comfort. Derek, you're probably a lean guy. I'm 70 years old. I can look down, I can see myself. Most guys my age, most guys your age, they look down, they see belly. So putting on a ring when you can't see yourself can be a challenge. So that's what it looks like when it's on. This component here is pressing against the urethra. By pressing against the urethra, we draw out the orgasm. We produce a more profound orgasm. And who doesn't want to have a more intense orgasm? My previous attitude until I came up, this would have been, I don't need it. My orgasm is fine. I don't have sex without it now. Not because I need it, because I want it. And we're also putting a ring around the top of the testicles here. And by doing that, we increase the sensitivity of the testicles. And the testicles in men are a secondary erogenous zone. What do guys like with sex? Well, most guys like them to be touched, caressed, whatever. And women like to grab a hold of them, and even or male parts like to grab a hold of them and play with them. So what happens to balls during sex unless they're being held in place? Well, they're up, they're down, they're here, there. They're not anywhere where they're going to do any good. So the ring was designed to enhance a man's pleasure. This is what the needle is like. Gives you score.
And that's good.
So
explain the erectile fitness score at the top there.
Yeah, the erectile fitness score is determined by a computer, and it's based upon your average firmness, your average number of nocturnal erections, average duration of your sex erections, and your nocturnal erections. And it's something to watch. It makes it objective. It's like following your blood pressure, following your pulse, or if you're doing any other activity you'd like to, and you're trying to measure your performance. Now we do that for sex, and that's revolutionary. And it's not just fun from kind of a gamification approach, but it's also it's really educational. Even for me, I can tell you how I've used it. Taking blood pressure medication, my firmness went down about 15%. But why would I take that medication? I didn't tell the difference. If I go from this to this, I don't know the difference. But why would I take something that's providing less blood to my favorite organ any more than I would take a medication that was sending less blood to my brain and my heart? So, alcohol, I can see the deadening effect of alcohol upon my sexual health. So if I drink, my nocturnal erections go from 7 or 8 in hardness down to a 4. Well, maybe I should drink less. I shouldn't drink hard. Regularly.
Well, that was one of the reasons I really wanted to have you on. Is like my excitement around being able to measure something that is so important, yet we kind of brush off to the side, and the implications of having these like significant measuring tools for some of these different areas is so valuable because, like you were saying earlier, is the therapy working? Is the treatment working? Is the compound working? Is the medication working? Like, if one of the big questions we get all the time is like, should I take these vitamins or these supplements? And there's always a thing of like, well, what's the outcome that you want? Because if you don't have a way of measuring that outcome, then you're not going to know when you can stop taking them either. And so then we're always going to be kind of stuck on this carousel, very much so in this world.
Yeah, well, a man with erectile dysfunction, frankly, a man who's really interested in improving his performance, he could be normal, but wants to be better. They'll try almost anything. Guys will like fucking walk on broken glass in order to make their dick harder. And as a consequence, where there are hopes, there are dopes, and whether you're going into a gas station and grab a supplement, or you're going to a naturopath, or you're going to a sexologist, a lot of the stuff that they are recommending simply doesn't work. They might not know it. I mean, I'm not saying these people, they're all bad people. I think some of them are just moneymakers, but some of them are believers as well as, people who are profiting, and they believe, and they're wrong. These things aren't working.
Let's dive into that a little bit. What are the things, like, I love the technology. I love the way that you can measure stuff and give people real data. What have y'all learned from doing this? What are the things that y'all found that work really well? And then obviously,
Sure.
what are the things that we're wasting money on?
Well, the things that don't work well, the things that and when I say work, is I have a test group of 6 guys. They're in Montana. There are some papers that will come out about this. But we have a test group of 6 guys, and of course we joke with the company because the emphasis right now is in research is on testing people from all different backgrounds. Heck, I'm in Montana. Everyone here is white. That's just the way it is. So I got 6 guys, age 27 to 70. I'm the oldest, and we've tested. Well, I'm not going to show you that. I don't want to insult these guys' products. But we tested nitric oxide, but that's precursor. Nitric oxide is what PD5, the Cialis Viagra medication, stimulate. We tested the pills. We've tested the cream. No impact whatsoever. DHEA, L-arginine. So these things are substrates that are necessary for us to perform sexually, but ingested orally, they don't have any impact. It's kind of like taking more vitamins when you don't need we don't need vitamins. We have I've had several people, including myself, test testosterone. So it appears that if you're genuinely low testosterone, the injections will help. But if you have testosterone that's in the normal range, I'll talk about my own personal experience with it. So I'm 70, so I'll get involved in this space, and I find out that pretty much all my friends over age 50, where they have low testosterone or not, are taking testosterone because they think it's going to make the sexual performance better, and other valuable things as well too. I asked my urology advisor, so I'm going to take it. What do you think is going to happen? And they predicted incorrectly that I would have more nocturnal erections, and that the nocturnal erections would last longer. We focus on nocturnals because those are more objective. Hey, they're not contingent upon pornography or my wife or other stimulation. And they made that prediction on the basis of what they're being taught, and it's not true. And so we've had 6 guys now who with testosterone in the normal range. 3 of whom swore that it was making them super harder. That didn't have any impact. No, I will say that I can bench press about 10% more than I could when I started taking it, which is nice, and I can curl about I can curl 7% more in weight, but in terms of the impact that guys are most concerned with, nothing. What else? A really interesting effect is this will be a paper abstract published about this in May probably, and then there'll be a paper published a year later. We tested the ring versus tadalafil, and we're looking at D2-mess. So D2-mess is the time it takes for an erection to go down. So the more blood that's held in the penis, the longer the erection is going to stay up. And there are claims made both by the PD5 medications that they are constricting on the venous side. I don't believe that very much. And then the ring, obviously, will constrict on the venous side. So we have these aids to prevent the erection from going down and holding blood in the penis. So on average, the erections go down about 35 seconds in men who were normal with nothing. With tadalafil, 10 milligrams, it's a little bit over 2 minutes. With the ring, our ring, of course, it's 4 minutes. And with both together, it's over 5 minutes. So the message really obviously we need to study larger numbers, but the message really to all men with happy D or just trying to have a better time, put a ring on it and take a PD5 medication. And I think that will be the norm 3 or 4 years from now. I look at vibrators in my lifetime, and like my mother's vibrator, was in the bottom dresser drawer of a supply closet that she thought the kids would never find it. I don't know. My wife must have owned 7 or 8, and my daughter takes them on dates. They've been normalized. I mean, 60 million women in the United States own more than one vibrator. It's no longer considered to be shameful. There's no longer, emphasis on, oh, you got to have an orgasm without a vibrator. Guys have shit. We got these stupid strokers that looks like it beat someone to death with. And then you have rings. And as you and I were joking before the show, straight guys have a negative attitude towards rings. One, because they're uncomfortable. Unlike ours, they're these hard silicone rings, they hurt. 2, they kind of this male pride thing. Well, I don't need it. Well, but it's not really about need. If you want a better orgasm, put a ring on, take a pill, and actually do it, man.
Yeah. Have y'all gotten any feedback on pain improvements from this on pelvic pain? Any changes with that?
I haven't heard about that. Be interesting to study that though. We have had men with pelvic floor issues find our device to be valuable, but then I wonder whether their issue is primarily a pelvic floor issue or whether it's a smooth muscle vascular issue. It's really hard. It's in your area of pelvic pain and attributing ED to pelvic pain. It's multifactorial. A guy with a significant pubic muscle issues, or has had bladder surgery, scar tissue, whatever, they're gonna have problems. And a ring in those cases can be, if not directly valuable, it could be a confidence builder. With the ring on, guys know that they're going to be able to. Once they get an erection, they're going to be able to keep it. So, because most guys' problems, Derek, it's not that they can't get an erection. Most men's problems is that they get an erection, they lose it, and they lose it for a whole variety of reasons, from anxiety to disease to medications, alcohol, etc.
Yeah, I mean, when it comes to some of that stuff, again, I'm gonna geek out on being able to like test these things because I don't know that we've ever been able to do this. But and you're talking about the studies that are coming out with it. So we talked about seeing that most of these kind of typically talked about supplements didn't seem to make a difference. Have y'all done things like lifestyle changing, diet changing, exercise, like any of that stuff that y'all found was valuable?
Those are important things, and we've not tested them. Certainly, if someone wanted to do research utilizing our device for those things, that would be great. We certainly have had men who have had lifestyle changes, but in terms of long term, no. But lifestyle changes in this sense, we've had 2 guys in their 20s who were bodybuilders, but they were trying to have kids, and they're attributing their issues to having kids to, I'm new job, stress, just got married, and they had weak nocturnals, and they were not just taking testosterone, but both of them were taking other steroids that were killing their dicks. They look great from the outside, but they're killing their dicks, and they both, to your point earlier, suddenly seeing their data right in their face, they couldn't deny it. I am 26 years old, and my fitness score is 5. And Elliot's score, he's 70, and he's a 9. What this is a wake up. I've got to stop doing what I'm doing because having an extra 2 inches of pectoral muscle is less important than my wife's pleasure, my pleasure, and having kids.
Yeah, absolutely. I think about half our audience is healthcare practitioners and half are patients who will be consumers of this. I really hope that we start to take this and start pushing forward with like adding something like that gives us true measurable data in our research around these things. There was a really good study that taught a bunch of men pelvic exercises. And as you've talked about, it is much more important that it's smooth muscle, though they did see an improvement. The men did improve. And the explanation, I'd love to get your kind of talk. The explanation was that as they improved the skeletal muscle, that they decreased venous return and allowed kind of improvements in sustaining the erection. I know you've talked about venous leak syndrome before. Can we dive into that a little bit?
Yeah, let me just back up to what you were saying before. So, the skeletal muscle is a little bit involved in retaining blood in the penis, but it's not the major factor. Right. And I think, in my observation of people who set out to make themselves fit, their confidence increases as well too. And I think that's a big factor. I mean, the guy loses 25 pounds, his wife no longer thinks just God wants to make love, wants to make love to him again. That's it's kind of to change the lifestyle. He's more he's people more confident about the way they appear, obviously, and they're more confident. They're not going to feel that someone's going to reject it because of their blubber. A venous leak syndrome is really interesting because the urologists think about it in terms of surgery, and they also think about it in terms of things that something that people are born with overall, or that people develop late in life because they develop significant diabetes and hypertension. But all men get venous leak syndrome. We all get venous leak syndrome as we get older. How can I say something as broad as that? You're a young guy. I don't know if this happens to you, but at my age, if I get to sit on an airplane for 5 or 6 hours and I'm in good health, my sock's a little bit tight at the end of the day. My ring sticks on my finger more if I hold my arm in a dependent position. Well, that didn't happen to me when I was 25 years old. Why? Because the smooth muscle around my small veins was stronger and were pumping the blood back to my heart. As I get older, those muscles weaken. They're smooth, and as a consequence, our venules, our little veins, they leak. And if they leak, then when it comes to they leak, our feet swell. If they leak in our penis, we lose our erections. And so at my age, if I get an erection, I'll lose it faster than at your age, or than when you and I were both 14 years old, when I could have a hard on forever. So our smooth muscles are weakening, and a ring becomes a confidence builder, not just for the man, but for his partner as well too. His partner, she knows, or he, or the partner knows that this person, once they're turned on, is not going to lose their erection. When we came up with the first ring prototype, it was February in Montana, and Derek, you married?
I'm engaged.
Okay. Well, you haven't probably not have experienced this yet, but when you're with a woman for a long time, one of the most common guy complaints is, in the middle of sex, even when they're really turned on, women will just start talking about something else that's on their mind, a fight they had with their mother, something that went on with the kids. So redesigning your house. So it's February. My wife and I make love, and she suddenly says, "Oh, I left the garage door open." Well, in Montana, that's a problem. So it was snowing. Ordinarily for me at age 70, that would have been a WTF. You can't hold that thought for five effing minutes. Game over. We're not having making love. I would have stalked off down the steps and been pissed off, because not only was the garage door open, the garage was open, and the left rear door of her car was open as well too. So I was coming up the stairs, and she said to me, "Oh, that tequila that I really like, can you put some on ice for me with a little bit of lime?" Like, ordinarily, that would have been a second WTF. I can't believe you go get it yourself kind of thing. But I got the ring on, and I'm a guy with a heart on. I mean, really, I was, 5 or 6 minutes gone by. I come back upstairs. I'm at like 3/4 heart on with two tequilas in my hands. Like, oh, and we both laugh. I'm ready to have sex again, and ordinarily would have had a fight. So that's another impact that we've experienced, my wife and I, and other men who experience with this ring, is it's a game changer in terms of their intimacy with the partner. In terms of confidence.
And I think all of that is where like this continues to grow, is to continue to like start showing, hey, as this improves, so does this. As this improves, so does life satisfaction. We'll have to chat about some of this stuff, because when we started doing just generalized health changes for patients, we do regenerative therapy, and we combine a lot of things, and we have a lot of patients who come and do contrast therapy. Well, they'll do sauna multiple times a week, which we know has massive changes for blood flow, improvements on a lot of different levels from a hormonal standpoint. And they would also do cryotherapy. So we would do contrast, where they would go from sauna into minus 200-degree cryo chamber. And I would venture to say that at least probably 60 to 70% of our patients over the age of 55 came back and unprompted, hey, listen, like my ability to Follow through with sex is much better.
Awesome.
What's going on here? And you're like, well, here's what we would think is happening there. But to not have a way of measuring that, everybody's just guessing, and you don't know, should I keep going with this? How much should I keep going? Should I do more? Am I on the right level? So to see some of that stuff improve from an objective measure seems like there's an endless world of possibilities with something like this.
Yeah, because are they? I'm really fascinated, by the way, about cryotherapy and about saunas. I've actually been talking with my wife about getting a unit if I can't find a place that's convenient in town here. I'd like to find a gym that has one. It's just easier that way.
Yeah.
But are people feeling better because their overall cardiovascular tone, so to speak, has improved? Is that it, or is there actually something going on specifically with their erections? Is it in other words, is it a confidence builder because their overall health is better, or is it something actually specifically going on in terms of the blood flow in their penis? I don't know. I'm interested in that. If you want to study that, I'm open to that, man.
Yeah, absolutely. In terms of like when people start using this, do y'all give guidance on, if somebody, like you talked about, the 30-year-old who's a 5 on the erectile fitness score, is that what it's called?
Yes.
What do they do? Like, what's the next step? Is that just to connect, or do y'all have, hey, here's probably some good places to start?
Yeah, we recommend they see a healthcare provider at this point. We don't. Well, first we recommend that they get at least 4 data points, because it could be that, hey, the guy just got really drunk and stoned and his performance is terrible, not or so we recommend 4 data points, and then we send a notification to people. So if that guy had consistently weak nocturnal erections, or I'll make up something else. He's only lasting 90 seconds rather than more than 3 minutes, or he's unable to ejaculate. We send notifications to people and recommend they see their healthcare provider. We're not giving out advice right now. I do offer to everyone who buys the tech ring 1 free consultation with me, in order to help people, because I enjoy that, and I'm also obviously I want to learn about how people utilize the device that's valuable to the company, but I want to help people and recommend people like you, for ongoing treatment. So we're not giving ongoing treatment at this point.
Gotcha. Yeah. I think there's a lot in that. It's like, what other tests would you want somebody to have done? Obviously, we want to, look at all your like kind of cardiac profile and, certainly inflammatory profile, blood sugar.
Right.
I'm sure there's a path you would want them to go down if they saw their healthcare provider.
If they have a problem it's probably going to be more complicated than I can solve in a phone consultation. Some things I can. I mean, I had a guy contact me yesterday who takes him more than 60 minutes to ejaculate. He's taking a whopping dose of Wellbutrin and an ADD medication as well too. I think it's Ritalin. Large doses of both. I told you why don't you talk to your psychiatrist about cutting these things in half, because you're depressed and and your wife is irritated, and you're really not you have. But I really take it beyond that level of advice. So I refer to people like you.
So we've talked about half of the kind of epidemic of sexual health. Let's flip to the other side of the coin and chat a little bit about the women's side of things. From what I read, although erectile dysfunction is probably mentioned much more, it seems like there is just as much of an issue from women's sexual health as there is for men.
Well, they call it FSD, female sexual health, and there's a real desire. Hey, I'll speak about female sexuality. Men, we get dumped on. We're limp dicks. We have ED. Back when I was in my early years of medicine, women were described as being hysteric or being anorgasmic or frigid. You don't hear those words anymore. But there is, the urologist, the gynecologist, called female sexual dysfunction, and it's worse than it is with men. Post-menopausal women have all the same problems. They lose hormone protection as they go through menopause. They have all the same problems that men do over the age of 45 or 50 with diabetes, hypertension, atherosclerosis, etc. Women have more of a tendency to obesity than men do, as with the hormonal changes as well. And those things are all negative in terms of their sexuality. But premenopausal women, they want to blame the problem on guys, but they take birth control. I mean, I think it's more than half of women under the age of 35 taking birth control, and about 25% of women taking SSRI antidepressants. They take antidepressants about 4 times as much as men do, and they take them in large doses. And both those things are killers of libido, killers of clitoral health. So we have come up with a technology, a wearable for women. In the prototype phase, we tested on 38 women that will measure clitoral health. And it's our thesis, we haven't done this yet, it's our thesis, though, that women have nocturnal erections just the way men do. Only their erections are different. This is really interesting. This is something that I didn't know until 5 or 6 months ago. So when men have an erection, the blood is contained by the epidermis around the penis. The blood doesn't leak out of the penis. It might leak internally through the venous leak, but the blood doesn't leak outside the penis. Most of the clitoris is internal. So, and it's not surrounded by epidermis. So as the clitoris engorges internally, what happens? Well, it transudates. So I thought, and almost every doctor I've spoken to, everyone I've spoken to, thinks that vaginal secretions during arousal are mucus. Well, there are mucus glands in the outside of the vagina. There are some periurethral glands that can ejaculate, the G-spot, but that's just a small amount of it. The majority of the vaginal secretions are transudate, a blood transudate. Think like when you have a blister. It's serum. So the cells, the platelets, are retained inside the clitoris. But the fluid transudates. That's really fascinating. So as women get older and develop the same issues that men do, they get hypertension, diabetes, they get less blood flow. They dry up. Now the notion before this is that they're drying up because of hormonal changes, and so that women who get estrogen creams and things to reduce their secretions, and that is a part of it. But I suspect, and I don't know, but I suspect this it might not be the greatest part of it, at least until. I'll put it this way: the vascular challenges from diseases like diabetes and hypertension are just as important as decreasing hormones. And we do know that if we give women, and I think this will become the norm in the future, it's not being done very much in this country or anywhere except by specialists. Women need testosterone. And just a little, giving men testosterone is less effective because we already have it. But to give a woman who's postmenopausal, who has no testosterone, a little bit of testosterone, is to rejuvenate their libido for many women. So we have this device. We hope to come out with it a year and a half from now. Women will be able to measure their sexual health the way they might measure their blood pressure, or they measure their cardiac health with an electrocardiogram, or the way men can measure their erectile health, their erectile fitness with our device.
That's fantastic. We'll have to do a round 2 whenever that gets closer.
Sure.
I don't want you to have to divulge too many secrets on how y'all are doing that. I have questions though. Have y'all gotten pushback from the medical community about doing any of this? What are the OBs saying? Well, I guess y'all aren't to that level yet, but
urologists say, they're all just really enthusiastic about it.
Good.
There's a little bit of skepticism. Because it's fresh, it's new. They haven't heard about it. How does it work? But there's a lot of enthusiasm. Our booths at urology shows are crowded, as they are at the Sexual Society for Medicine, Congress shows, because there's a minority of men who need surgery, and most of the congresses or conventions are about surgical procedures. We're about helping men before they need surgery. So we're all men are on this path from erectile fitness to erectile dysfunction. And with data, that's cliche goes, if you can hack it, you can track it, you can hack it. With data, we can actually say, okay, here's where I am. I want to either reverse things or I want to stop the things from getting worse. And the urologists are really enthusiastic about that. Although in the United States, it's not the urologists who really take care of men with erectile dysfunction. It's their nurse practitioners and their PAs, and that's unfortunate.
Yeah, yeah. This is I'm always excited whenever there's like a new area of information that people can start to use to truly change stuff. I think we empower people when we give them more information about their health. And so this is why we always talk about, like, getting regular tests and checkups and stuff. And this is very exciting to give people power over something that I know a lot of men, and they've told us they feel powerless around it. I've tried these things. It didn't help. I don't know where else to go. So I love what y'all are doing. I really do. I think, this has the potential, one, to create a crazy amount of data. I know I've mentioned it too many times because it excites me, of what really helps and what doesn't. Where are we wasting money, and where are we really, let's tweak it. This is making improvements. Let's add and layer on some things that can help. So I love what y'all are doing. Where can people find more information about FirmTech? Where can they follow y'all? Where can they find some science, all that stuff?
Sure. You really look for us at myfirmtech.com. It's myfirmtech.com, myfirmtech.com. Feel free to contact me at Elliot, ELLIOT, at myfirmtech.com. We have a science section. We have how to use it. We have YouTubes. We're not much of a presence on Instagram. But then that's not really Instagram is really not for education. Instagram is it's for social media. So if you want to learn about it, go to our website.
Nice. I love it. I love it. Doc, we ask all of our guests, if people listening to this can do one thing to improve their health today, what would that one thing be?
Plan for pleasure. Guys go to the gym 14, guys go to the gym 10, 14 hours a week, and their relationships suck. Take a couple hours out of that gym time and plan for pleasure. Don't rely upon spontaneity. If you want to cook a really great meal, you don't go to the refrigerator and say, what's here? No, you plan. If you go to a good restaurant, really fine restaurant, they're not being spontaneous. You need to plan for pleasure, make your life better by planning for pleasure, and your partner's life better as well, too.
That's very, very, very sound advice. Dr. Elliot, thank you so much for what y'all are doing, man. I really appreciate it. Thanks for coming on.
Thank you, Dirk. That was a pleasure.